Good day. Welcome to our adult immunization series. This lecture will focus on influenza as a vaccine-preventable disease from the Guide to the Philippine Health Examination Recommendations 2022. Appraisal of best available evidence on 8 identified clinical questions which followed widely accepted grade approach evidence to detection framework criteria are presented in this lecture. Influenza in the Philippines has a mean annual incidence rate of 5.4 per 1,000 individuals in urban regions. Among adults, the most number of cases were reported in the 40 to 64-year-old age group, followed by the 65 years and above age group. Influenza is estimated to account for an average of more than 5,000 excess deaths per year, majority of which occurred among adults 60 years and older. Significant morbidity and mortality are associated with viral influenza, particularly among women, adults older than 65 years of age, and people with comorbidities. Pneumonia is the most common complication of influenza, and it may also cause exacerbations of underlying chronic lung disease and cardiac diseases. Vaccine types of influenza are two. We have the trivalent inactivated vaccine, which protects against 3 different flu viruses: an influenza A H1N1 virus, an influenza A H3N2 virus, and 1 influenza B virus. We also have the quadrivalent vaccines, which protect against 4 different flu viruses, including 2 influenza A viruses and 2 influenza B viruses. Influenza vaccination is indicated for the following individuals: those who are 50 years of age and older, healthcare workers, residents of chronic care facilities and nursing homes, those with chronic disorders, including pulmonary, cardiovascular, renal, neurological, and metabolic diseases. Influenza vaccination is also indicated for those with HIV and AIDS, immunosuppressed persons, pregnant women in the 2nd or 3rd trimester without a flu shot in the last 12 months, healthy persons providing essential and emergency community services, and students and other persons in institutional settings. Influenza vaccine can be given intramuscularly or intranasally. Influenza vaccine is given annually with a single dose between the months of April to May, and this is based on a retrospective analysis of the Philippine influenza surveillance data last 2012, which was conducted in RITM. It was seen here that although influenza virus circulated throughout the year, a distinct seasonality was observed from June to November, such as the recommendation. Influenza vaccine is contraindicated in persons with severe allergic reactions to a vaccine component or following a prior dose of vaccine, those who have moderate to severe illness with or without fever, and those with a history of Guillain-Barré syndrome within 6 weeks following a previous dose of vaccine. Now we'll look at the summary of recommendations. Here, among healthcare workers, it is suggested that annual influenza vaccination using inactivated influenza vaccine is done, and among healthy adults, pregnant women, and elderly, it is suggested that annual influenza vaccination using inactivated influenza vaccine is also done. Now we look at the specific evidences based on the benefits and harms. So in summary, inactivated intranasal influenza vaccines have significant benefit in reducing laboratory-confirmed influenza and influenza-like illness. However, no significant effect on hospitalization, missed working days, and serious adverse events for inactivated vaccines was seen. How about for pregnant women? It is seen that inactivated influenza vaccines have significant benefit in reducing infant and maternal laboratory-confirmed influenza and maternal influenza-like illness. However, no significant effect on infant and maternal mortality, infant hospitalization, and serious adverse events were seen. This is the data for healthcare workers using inactivated influenza vaccine. In summary, evidence for healthcare workers showed significantly reduced laboratory-confirmed influenza among healthcare workers following influenza vaccine. There was also no significant effect on influenza-like illness, missed working days, and serious adverse events in healthcare workers. There was also no significant effect on laboratory-confirmed influenza and hospitalization among the patients of these healthcare workers. This is the data for the elderly following inactivated vaccine and live vaccine. For the elderly, the summary is that inactivated influenza vaccine significantly reduces laboratory-confirmed influenza and influenza-like illness. However, no significant differences in systemic adverse events was seen. For live intranasal influenza vaccine, there was a trend towards benefit in laboratory-confirmed influenza. However, there was a trend towards harm in systemic adverse events, but results were not statistically significant. How expensive is influenza vaccination? The summary of cost-effective studies involving influenza vaccination of adult populations in Southeast and East Asian countries included 10 studies for which all reported that influenza vaccination is cost-effective. Here's the list of the prices of the influenza vaccines, regardless of brand. How accepted is influenza vaccination in the Philippines? A Philippine study published in 2020 identified 8 barriers to influenza vaccination, namely, patient perspective that vaccination is not a priority, patient perception that they are at low risk of getting influenza, lack of awareness of severity of influenza, indigent elderly Filipinos who qualify for free vaccines may not be aware of such, vaccines are considered expensive for some, vaccine availability may be delayed for a few months when the influenza season has already started, limited supply of free influenza vaccines, and improper storage may compromise efficacy of influenza vaccines. There are recommendations from other groups for influenza vaccination. There are 6 international and 1 local guidelines that recommend influenza vaccination among adults, and 5 guidelines specified high-risk adult populations that should be prioritized, including such, which is also the same as our local guideline. We hope that this lecture has able to help you to advocate better on influenza vaccination. These are our references. Thank you and good day.